Hey everybody, today I'd like to take some time to talk to you about why not to do drugs. Most people would say, well, I don't have a problem with that. I don't need to hear about this. But a lot of people in today's society have a problem. Men, women, and children all around the world. Today I'd like to talk to you about one drug in particular, and that's methamphetamines. I'd like to talk to you today about the health problems it causes, how it can break up any home, and how it can end you in prison or jail or death. First thing I'd like to talk to you about is the health problems that it causes. Methamphetamines, or meth on the street name, increases your heart rate, increases wakefulness, physical activity, makes you have irregular heartbeats, increased blood pressure, and your body temperature. These are some things that nobody wants. Long-term uses for methamphetamines are also mood disturbances, anxiety, confusion, and severe dental problems. I printed a picture off the website. This is somebody's mouth that has been doing meth for years. This is not what anybody wants their mouth to look like. There's another picture that I printed out from the website of a lady who had been using for 3 to 5 years. Meth causes many sores to be on your body, and as you can see in her picture of a 35-year-old lady, she looks about 55 to 60 years old. Meth will tear your body down. According to drugabuse.gov, 1.2 million Americans 12 years and older have tried meth in their lifetime, 1 year prior to the interview. So that means at 11 years old, there are kids in the United States that are doing meth. The second thing that I would like to talk to you about today is how meth can break up any home. According to the addictionrecovery.org, meth is Satan's best friend. Meth will break up any home. When you do meth, you don't have a sense of yourself. You're not living for you. You're not living for anybody else. You're just living for you. That's it. You're just waiting to get your next high. You don't care about anything or anybody, just how you can get your next high. You will rob, you will kill, anything, just to get what you want. Meth breaks you into someone that no one wants to be, and for most of the time, it's very uncontrollable. You care for no one. You're all about your next high. According to SAMHSA.gov, 99% of people that go into treatments are meth related, and 45% of these are women alone. The next thing that I would like to talk to you about is how meth can end you in prison or death. According to justice.gov, it's an ugly and painful way to go. They state at methproject.org that the same ingredients that you use to make meth are the same things that you use to make a bomb. If you think about that, do you really want the stuff that you make a bomb with putting inside of your body? There are actually many different ways that you can do meth. You can snort it, you can eat it, you can smoke it. People smoke it on aluminum foil, or they also smoke it in a glass pipe. There's another way you can also inject it, which, as we know, has to be called shooting up. When you shoot up, you take the risk of getting HIV, AIDS, and hepatitis. These are just some of the other health problems that meth can cause. Meth labs also are very dangerous in anybody's house, especially when children are present. Not only are you taking the risk of hurting yourself, you're taking the risk of hurting innocent children when they didn't even ask to be brought into this situation. Well, today I've talked to you about this particular drug called meth and how it can break up a home, how it has health problems on you, also how it's an ugly and painful death, or even ended up in prison. With these facts today, I hope that if you know anybody that's having a problem that you can help them to get help, or if you ever just thought about anything, just please do not do meth. I also have one more picture, just in case if you didn't know what it looks like. I got this off the internet. This is what crystal meth looks like. This will break up your home and will kill you. Today, I hope that I've provided many things to help you along the way. Thank you.